Hey guys, this is Greg with Medical Muscle. In this video, I wanted to talk about how SGU prepares you for clinical rotations and step 2. Okay, how well do they train you for that? And if I saw any mistreatment of Caribbean students compared to our US counterparts, I'll let you know what I saw. Okay, so for the preparation for clinical skills, I have to say that SGU did a very good job. So in our hospital, the SGU students hands-on skills, so like your physical, your ability to take an HPI, all that stuff, patient encounter is excellent. I've even heard that the attendings said that we were excellent, sometimes even better than the US students that they had seen. Okay, so all those B lines, all that small group work that you have discussing like how to go through your physical, how to be empathetic, how to, do all the physicals is crucial because, all those physicals are fair game in each, at one point in each specialty. You never know. Like in peds, you got to look in someone's ear. Okay. In the emergency room, you have to do a DRE. You never know when you need those skills, but we are well skilled in the physical stuff. All right. Now, in the clinical skills, I can tell you for sure that is dependent on the student. Okay, right? It depends on how much you're studying during that rotation. But just off the bat, I felt like SGU's focus on internal medicine and psychiatry, for some reason, those two were serious. I mean, I felt like I was well prepared for those two shelf exams without having to study directly for that stuff. I felt like SGU from terms 1 through 5 prepared me for those 2 rotations specifically. I don't know why psych. I think it's because it doesn't change too much from step 1 to step 2. It's similar content. It's just more like what's first line. But in the medicine section, the medicine shelf, and the bulk of step 2, which is mostly medicine, I felt like SGU did a great job focusing on that category. Now, that being said, I felt like OBGYN, peds, I felt like I was well trained. It's just there was a lot of content. But OBGYN and surgery, I felt like all that was brand new. I had never seen any of that. I mean, you've seen these medical conditions, but most of step 2 is not what the condition is. That's easy. It's what is the best thing to do in this specific situation to treat whatever's going on. Okay, and they didn't really train us in that. Because that one is a hands-on skill. A lot of that you're gonna learn while you're in the hospital. A lot of the questions I got right was because I saw a patient in that same scenario, like say in trauma, I saw something and I was like, oh, that's what happens. That's what they do. This is what they do when they're assessing, when they do a FAST exam. You know why they do that, right? Okay, or when you do that over CT, okay? So those are the ways that I saw SGU training, helping us and maybe not assisting too much in those rotations. Now, for seeing discrepancies in how SGU students are treated compared to the medical students, the US medical students at our school, I would say, and this may sound weird, that we got slightly preferential treatment. I'm not gonna say like how that makes sense. It's just a strange thing. I think it's because when you go to these hospitals in your rotations, you're gonna see a lot of the attendings have, guess what, come from SGU or the residents. There's a lot of us out there. It's a huge school, right? And the affiliated hospitals have, funnel pathways for residents to come in, and then some of those people stay and they become attendings at the hospital. So it makes sense that you'll come across those types of people. So that's kind of cool. One interesting thing, I was in surgery and there was an attending that refused to work with the students at that hospital for some reason, the medical students. He refused, absolutely refused. So guess what? SGU students were allowed to go to every single one of their cases. And it was fantastic because then we got first pick on this one type of surgical specialty. So I have to say, in general, I didn't see any kind of maltreatment of Caribbean students. And all in all, I think, you know, the US students and Caribbean students mix well. You know, we're kind of the ragtag group, I do have to say. The SGU students are more ragtag. But, you know, give us a good name. When you go to the hospital, be very professional. Study your ass off. That's what people actually care about. No one cares about what medical school you went to, okay? There's a few attendings that kind of gave me shit. They're like, oh, you went to a Caribbean student. What did you do? Were you a felon or something? He was cracking a joke though. I could take jokes like that. I thought it was funny. You know, most of the time, if anything, it'll just be a joke. But all in all, people really don't judge on that. They judge on your personal skills, your clinical skills, and your clinical knowledge. Like, what do you know? Have you been studying? Have you been staying up to date on what you need to know to better help the patient that's in front of you? Okay, that's what's important. All right, guys. All right, does that help? I hope you guys go out there and kick some butt. Oh, and don't forget to like and subscribe, please.